The next bill we have on the agenda is House File 908, and I see the authors coming down to the table. And I'll move the House File 908 to be before us, and it gets sent to Human Services Finance Committee. And I see we have a DE amendment. Representative Badji, is that your amendment?
Yes, that is my amendment, Mr. Chair.
Members, I'll move the DE2 amendment to put the bill in the order that the author would like. All in favor of the DE2 amendment? I'm assuming that's going to be the bill then.
That will be the bill, Mr. Chair.
So all in favor of the DE2 amendment to put the
Mr. Chair.
bill in the the way the author wants, Representative Schultz?
Yeah, thank you, Mr. Chair. Would the author of the bill please provide for us the differences in this before we vote on it?
Well, if it's going to, out in the back, can you either quiet down or take your conversations out so we can hear here, please? Thank you. Representative Schultz, she's going to explain the bill. The DE amendment means that there's nothing in the old bill. This is the new bill. So, Representative Schultz, so we'll put the bill, the amendment, the author's amendment on, which is customary and of doing at the beginning. So, all in favor of the DE2 amendment, please say aye.
Aye.
Opposed?
Nay.
DE2 is adopted. Representative Badji, if you want to explain your bill,
Yes.
as it is now in the DE2 amendment.
Thank you, Mr. Chair, and thank you, members. The DE2 amendment, which is now House File 908. So this is a bill that ensures that our workers in nursing homes are providing the best for Minnesotans who live in nursing homes. This is also a bill to help address the staffing shortage crisis we're seeing in nursing homes since the start of the pandemic. Unfortunately, we aren't going to be able to solve that crisis and give our nursing home residents the care they deserve until we address the crisis of compensation for frontline essential workers who keep nursing homes running. This bill aims to do that by creating a nursing home workforce standards board, and this is an idea dating all the way back to the Great Depression. It's getting new life around the country as a way of bringing workers and employers in specific industries along with our regulators to hopefully together work to improve both wages and working conditions for those that are caring for our loved ones. And in the case of nursing homes, that means stabilizing and growing the workforce to meet the needs of the employers, improving resident care, and doing so in a way that supports the state's goals of world-class care for an industry that receives 80% of its funding from the state. This bill would create a 9-member board appointed to staggered terms by the governor as required for a rulemaking body. And those members include 3 employer representatives from industries that I'm sure will testify today, 3 worker representatives, along with commissioners or their delegates from 3 agencies. And those agencies are the Department of Health, which is charged with regulating nursing homes, the Department of Human Services that funds nursing homes, and Department of Labor and Industry, which addresses labor standards. The Nursing Home Workforce Standards Board would be charged with investigating market conditions that would require direct engagement of workers and employers so that the board has the appropriate information it needs to set the minimum standards for wages and working conditions through rulemaking. These rules are meant to be reasonably necessary and appropriate to protect the health and welfare of nursing home workers. The labor standards established by the board would be enforced through the Department of Labor and Industry's existing authority, as well as a private cause of action, which is already modeled directly on the one that we have in place in our Fair Labor Standards Act in Minnesota. The board would also be charged with reviewing the standards it advances at least once every 2 years to ensure that they are up to date. Now, just to be clear, the authority of the board is limited to those conditions that affect workers in the nursing homes. This bill does not have any authority over the standards for resident care. To ensure that workers are aware of the board's process and how to participate, as well as the standards set by the board and their rights, duties, and obligations, should this bill become law, the Nursing Home Workforce Standards Board will be required to create a training curriculum to be delivered by worker organizations certified by the board and twice-yearly trainings. And employers will have to provide a notice developed by the board to their employees in whatever manner they already use to provide other work-related notices. So finally, this bill ensures that workers are protected from retaliation for exercising their rights under the bill, including participating in board proceedings and trainings. For some context, a similar bill passed the House last year in the HHS Omnibus Bill, and this year the governor has included this in a similar proposal in his budget. We all know how critical this industry is to hundreds of thousands of Minnesotans, and we also know that this industry is struggling. We have an obligation to provide for the care of our seniors, but unless we address the crisis of wages and working conditions in our nursing homes, we will never have the workforce needed to provide that care. Creating a nursing home workforce standards board is a proven way to address that crisis and give these essential workers, who we have spent the last 2 years praising and uplifting because they are doing a really good job, give those workers a voice in helping determine those minimum standards in partnership with the employers and the state. And so with that, Mr. Chair, I'll turn it over to testifiers that we have today.
And just quickly, could you explain what Representative Schultz was asking? What are the major differences between your first draft and the now the DE amendment?
Sure. So that, I just did a whole walkthrough of the bill, so that explains the whole bill. But in terms of like specific differences, I mean, basically we've clarified, where Dolly, the Department of Labor and Industry, has their authority. So that's in the first, in section 2 of the bill. And a lot of the other requests that Dolly has given us, we've also updated those in the DE2 amendment. So if you go through, a lot of it is really just clarifying different language, especially around some of the definitions. We've also clarified some language around staffing for the board, how the board votes, what their investigations look like, and how Dolly will also be supportive of this board through their staff. And then finally, we've also clarified some language around the duties of the board based on feedback that we've received from the Department of Labor and Industry.
Thank you, Representative Baji. First person I have on my list is Travis Burth. And after that, I have Rosemary Tisi. Welcome to the committee. Please state your name for the record.
Thank you, Mr. Chair Nelson and member of the committee. My name is Travis Burth. I am a server and a cook at Serenity Care Center. I am here on behalf of my union, SEIU Healthcare in Minnesota and Iowa. Our union represents about 50,000 healthcare workers around the state. We work in hospitals, clinics, nursing homes, and self-directed home care. We support the Nursing Home Workforce Standards Bill. I started working at Serenity in December of 2020. I was one of the few to start in the middle of the COVID epidemic, but I guess you could say I was born to work there. My mom worked in assisted living when I was young. I volunteered with her later. She became a cook at Serenity and I decided to work there. When I got out of the Army, mostly because I didn't have a car and my mom could drive me to work. I didn't choose Serenity for the pay. I got hired at $12.50 an hour. After 2 more years, I still only make $14 an hour as a server. That is barely above minimum wage in St. Paul. I qualified as a cook, but I still only make $17 an hour for my cook shifts. It is easy to find safer, less stressful jobs that pay more. I interviewed with an HVAC company that would pay $20 an hour. Unless you give workers in the industry a chance to set better minimum wage, we will never attract the workforce we need. I thought boot camp in the U.S. Army would be the worst experience of my life. Boot camp was not that bad compared to working in a nursing home that does not have enough staff. When I work weekends, we have just 2 servers for 2 whole buildings. Together, we have to feed 160 people. We have to get the meals prepared on the tray line. We have to distribute the trays to the dining room. We have to clean all the dishes. We can't do it on time. We are usually 30 minutes to an hour late. By then, the food is cold. Some residents miss meals completely because they have a medical appointment. Residents get angry and yell at the staff. I don't blame them. We feel miserable for being late. Every day, some coworkers break down and cry. They say, why stay at a job where you feel terrible every day? When we get new employees, they almost always quit. Even our long-term staff quit because they can't take it anymore. The short staffing is worse now than it was during the COVID outbreak. I feel bad. Sorry, let me repeat that. I feel like I can take it better than others because I have been in the Army. But what does that say about this industry? Margaret was another cook. She was a longtime friend of my mom. When I started, she took me under her wing. Because of her, I moved up from server to cook. We would try to support each other when the job got tough. But she got too stressed out and couldn't take it anymore. She quit because of understaffing. Without her, my job is even harder, but I don't blame her. I'm thinking about getting another job too. I am not a policy expert, but I can tell you what it feels like on the floor of a nursing home. We don't get treated with respect. Our managers pay us as little as they can and get away with it. I have had 3 administrators in 2 years. The problem is not just a lacking of funds. The business press says lots of people are making money from nursing homes. More of that money should go to workers on the floor. To get more money to the workers, you have to give them power to set standards. I am lucky. I have a union, and I get a voice. But too many workers don't have that chance. The bill wouldn't give them a union, but it would give them some say. We know there are good people in management. They face many of the same challenges we do. All we want is a chance to sit down with them and build something that gives our seniors the care they deserve. Please vote yes and support our House.
Thank you, sir. Next person I have is Rosemary. Welcome to the committee. State your name for the record and proceed with your testimony. And if we can short it down a little bit so we got time to discuss it.
Gian Nelson and the members of committee, my name is Rosemary Tisi. I live in Moundsville. I have worked at the Estate of Friedrich Nursing Home for 14 years. I am a trained medication aide. I am a member of SEIU Care Minnesota and Ohio. When people come to work at our nursing home, they ask, how come you work here? New employees say, this job is really hard. You don't make any money. Then they quit. They get an easy job and earn more money. That makes the old employees think they should quit too. It makes me think about quitting. When I started, there were 3 people to do the job, but we kept losing staff. Then COVID hit. Now I often have to do the whole job just myself. My job is to give people their medicine. They need to get their medicine on time. But with just one person, I cannot do it on time. I want the medicine won't work as well. Worse, I get interrupted because we don't have other staff. I see residents who are in trouble or about to fall. I have to stop giving medicine to help them. Then I am further behind. Sometimes I can't stop, and they get hurt. If you want more people to work at the nursing home, you need to pay them more money. I have worked for a long time. I have extra training, but I only make $18 as a TMA. Before COVID, I have worked for years without a rest. I don't make enough to feed my family. I have 2 daughters, one 6 years old and one 4 years old. I want to make enough money so that I can fix my car. I need my car to get to work. But they do not pay me enough to keep my car running. I want an easier life and a chance to be happy. Managers always make us fight for more money. If we did not have a union, they could not pay us more. Workers need more power. We need to make them pay us more. Please, for the years, thank you.
Thank you for your testimony. Next is Jessica Grosz. And after that, I have Toby Pearson. Welcome to the committee. State your name for the record.
Thank you, Chair and members of the committee. My name is Jessica Grosz, and I am the Director of Labor Standards and Apprenticeship at the Minnesota Department of Labor and Industry. I'm pleased to testify in support of House File 908, establishing a nursing home workforce standards board. The governor recommends establishing a nursing home workforce standards board that is responsible for setting minimum employment standards to protect the health and welfare of nursing home workers in the state. Minnesota nursing home facilities provide vital care to some of our most vulnerable citizens. Ensuring nursing home workers have a voice in the terms and conditions of their employment through worker participation in a nursing home workforce standards board alongside employer and agency representatives would improve job quality and worker retention and better support vulnerable Minnesotans. The board would adopt rules to establish minimum employment standards that are reasonably necessary and appropriate to protect the health and welfare of nursing home workers and to ensure workers are properly trained about and fully informed of their rights. The Department of Labor and Industry would have authority to investigate violations and enforce compliance with the Act, as well as minimum nursing home employment standards established by the board. Thank you for the opportunity to testify in support of this legislation.
Thank you. Next person, Toby Pearson, and then Aaron Hupert is after that. Welcome to the committee. State your name for the record and proceed with your testimony.
Thank you, Mr. Chair. Members, my name is Toby Pearson. I'm with Care Providers of Minnesota. Speaking today on behalf of the Long-Term Care Imperative, I will be joined by my colleague, Ms. Hupert. We'll do the second half of our testimony.
If she wants to come down right if they're together.
I don't know if she wants to sit that close to me.
She's coming down.
Oh, all right. First, I'd like to thank the author for meeting us to begin discussions around the proposal. We met for 30 minutes last Friday and have another meeting scheduled tomorrow evening to continue our discussions. The proposal has vast reach and technical implications, so we appreciate the author making the time to discuss many of our concerns with us. That being said, we still have to testify about our concerns with the bill in its current form. Nursing Home Workforce Standards Board has been described as a training bill or an attempt to improve wages and staffing at our nursing homes. However, it does nothing to accomplish the most fundamental component needed to make these improvements. That's increased funding for nursing homes. That's contained in House File 733. Appreciate any and all of your support for that file. Census restrictions, the extended duration of pandemic-related expenses, workforce wage competition for many sectors have created significant operational gaps with more expenses paid out than funds coming in. Nearly 50% of the nursing homes have increased wages by more than 10% in the last 2 years, but those costs are not reflected in our current rates. There's an 18-month lag from when we spend $1 to when we get $1 back. Doesn't count for inflation. Facilities have also spent thousands of dollars on PPE testing and other pandemic safety improvements, which again, they have not been repaid under the state's current payment system for nursing homes. To address our caregiver shortage, nursing homes need permanent funding from the legislature. To put a bit of a finer point on it, long-term care is currently down 20% of our workforce. Minnesota has an access problem. You've heard about hospital backups. You've heard about denials of admissions from the community. In fact, last fall, we had over 11,000 denials of admissions of individuals seeking placement in nursing facilities. Nursing homes have closed or laid away over 2,400 beds in the past 2 years. That's the equivalent of 48 medium-sized, about 50-bed facilities have closed. The main reason for these is a lack of workforce. Bottom line, nursing homes need more funding so we can raise wages. We have various concerns regarding this proposal. Some of them are philosophical, some of them are practical. I'd like to just point out a couple and then turn it over to Ms. Hupert to get into some finer details. The model has not been used in other states in these settings. Michigan did have an advisory group for the governor and the legislature, but they did not have rulemaking and unilateral authority. The proposal sets up an appointed committee. The committee does not function like other labor negotiations at a labor table where both sides sit down, hammer out an agreement, and then both walk away somewhat satisfied and somewhat dissatisfied, but that's compromise. Minnesota does have a model in the form of the Workers' Compensation Advisory Council that has labor and employers working together, hammering out their differences, and then only if they all agree does it move forward to the legislature and or go to rulemaking. The appointed board has virtually no legislative oversight. Instead, it's the governor's appointee and department folks determining many issues that would typically be negotiated at the bargaining table. While we have many questions on the budgeting and facility payment implications of decisions of the board, we assume that will be covered in the Health and Human Services Committee, just as we assume Civil Law Committee will address other civil action questions. I would again like to thank the author for having met with us and continue to meet with us to try to work out some of our differences. I will now turn it over to my colleague, Ms. Hupert, for some more specific issues of concern.
Welcome to the committee. State your name for the record and proceed with your testimony.
Thank you, Mr. Chair, members of the committee. My name is Erin Hupert. I'm the Vice President of Advocacy for Leading Age Minnesota here on behalf of the Long-Term Care Imperative. To pick things up from my colleague, we are still reviewing the DE2 that you adopted, so I will draw attention to a few concerns by section, again acknowledging that it's not exhaustive. Section 4 in the definitions, subdivision 7 defines nursing home employer. That current definition we feel is broad and could impact non-licensed certified businesses who have employees who also work in a nursing home. Subdivision 8, definition of nursing home worker, again, concerned that it may be overly broad. We're not sure how this definition handles ancillary staff like therapists, lab technicians, medical staff like medical directors or physicians, supplemental nursing staff and their employers. Section 5, establishment of the board. As mentioned by my colleague under this rubric, simple majority rules with potentially inequitable interests around the table, whereas at a bargaining table, even under the process established by the WCAC, which is also operated within Dolly, there are equal members of labor and management as well as legislative appointees, so that the legislature has oversight and eyes into what is happening at that WCAC table. Section 6, duties of the board. I would point out that it requires the board to adopt rules no later than August 1st of 2024 and requires the use of data, including current wage and benefit data. For those of you who have the pleasure of serving on Health and Human Services, you know that there is a 2-year lag between data submitted to DHS and then what is approved for a payment rate. So we're wondering which version of data would be used under this particular model. In subdivision 4, it appears to preempt the board's rules with other agencies. So we are already subject to rules and regulations by OSHA, Dolly, MDH, DHS. Those are designed to protect the health and safety of seniors as well as workers. So if you look at page 5, line 24, it appears to add occupational health and safety standards under the board's purview. We're not sure how that is reconciled by those already established by Dolly and OSHA. Again, these are just a couple of examples. In section 7, which outlines the training of workers, subdivision 6 requires nursing home employers to provide proof that to Dolly that every 6 months each of the nursing home workers has completed their training. We have a couple of logistical questions about how that would work. It is one thing to make sure that employees are aware of training, provide them access to training, and even compensate them for that hour of training. It is a different thing to make sure that they take it every 6 months. Sometimes, for a variety of reasons, employees are just not able to take or don't have interest in taking a training. I will personally say that I am very much behind in taking my obligatory IT compliance training. It happens on occasion. Related to the training component, the contact information and privacy of the employee appears to be an opt-out rather than an opt-in. So, in other words, an employee must actively seek to protect their privacy and opt out of having their information shared. The compensation for travel under subdivision 7 is probably more for DHS, but we do have questions about how those expenses would be reflected under 256R. As my colleagues stated in the beginning, we have some pretty serious concerns about the bill as presented. Chief among them, that nothing in this legislation improves wages, which requires legislative action. By contrast, House File 733, which has bipartisan support and was heard in Human Services a couple weeks ago in the House, would actually facilitate those wage increases. We remain willing to engage in the conversation with proponents and with the bill sponsor to refine this proposal as it moves forward. Thank you.
Thank you, Ms. Hubert. Questions? Members? Representative Daniels.
I have a question for Toby Pearson. When I started in 2015, we had the newly formed Aging Committee, and we got to talk quite a few times. But I can't remember. I know we did a sizable increase to the nursing homes for funding, and I have a number in my head, but I'm not sure it's right. Do you happen to remember what the increase was?
Well, I think what you're referring to.
Pearson, and that's kind of out of the purview of this committee, but go ahead and answer.
I'm sorry, Mr. Chair, Representative, I think you're referring to the value-based reimbursement system that was implemented in 2017. There wasn't an exact amount. Instead, it was a newer way to recognize costs and pay facilities for costs. Prior to that, nursing homes, assisted living, elderly waiver would have to come in and ask for a % increase every year, oftentimes with our union friends saying we need X %, and then the legislature, unfortunately, would typically give us X minus %, and then we'd go home with less than what we asked for. But I think that's what you're referring to.
Representative Daniels.
Thank you, Chair, and thank you for the latitude. My memory is it was a good chunk of increase, and I remember going back to my local nursing homes, and they were so thankful that the increase was, they could use it for wage increases, they could use it for roofing repairs, they could use it for maintenance, equipment, and it was, a nice size. I remember that was something you felt good about doing. And then I've got a comment, not pointing towards you, but I thought maybe we could help with the numbers. We just, and I'm also on the Children and Families Committee, and we have passed out free meals for all, and that's going to add a lot of dollars to the budget. And some of it's federal reimbursed, some of it's not. But anyway, I just wondering from your perspective, Mr. Pearson, if that kind of money would help with your increase and with your needs, that if we could put that money into your nursing homes, would that be beneficial?
And again, that's not in the purview of this committee, but Mr. Pearson, if you can quickly answer, and I don't like pitting one group of people against another, but Mr. Pearson.
Mr. Chair, Representative, House File 733 that we referenced is a $52 a day add-on that is directed to nursing home workers' wages and benefits. We haven't received a fiscal note on that, but it's somewhere near probably about $1 billion over 4 years. So that's what we're asking. We've guessed that would be about $4 an hour increase for folks that would be working. So that would take us from about $17 up to closer to $20, $21 an hour for a lot of folks that are working.
Representative Schultz. That's on my list. You look shocked.
Thank you, Mr. Chair, and Representative Abaje. I appreciate your stated intent at the beginning of this presentation, and I just worry that this might be something that doesn't get to your stated intent. And I wanted to ask, frankly, kind of a qualifying question, like why would this standard, or why is the standards boards necessary, and who's asking for it to the tune of increasing wages for our caregivers?
Representative Abaji.
Thank you, Mr. Chair. Thank you, Representative. So again, going to the purpose of this bill, it is really to ensure that we have an arena where employers, employees, and the agencies that oversee nursing homes have an opportunity to work together to understand the conditions, and that can include wages. Not every board decision will necessarily accommodate wages, but those are under their purview. to ensure that the highest standards are being met in nursing homes. And we want to make sure that our workers are, at the highest standards that they can be, and same with our employers. Wages do come into that. And so this will be a place for them and an opportunity for them to have that discussion about what the wages are, and in a way that also holds accountable the employers who are receiving funding from both the state and federal government to ensure that that funding is being used in a manner that supports ensuring that we have the highest standards in our nursing homes.
Representative Schultz.
Thank you, Chair Nelson and Representative Abaje. I hear you, and I appreciate what you're saying here. My concern here is that currently that responsibility and that power is here at the legislature. And for me, last Friday, I went to visit the nursing home in my district, and I got to hear directly from the workers in the nursing home. There was about a dozen, and they had the chance to talk to their legislator. And frankly, I think I might be more accessible than this board for the future of workers here in Minnesota. So that's my concern with this bill. And I'm not going to take up any further time, but just simply taking this responsibility away from us sitting around this table and putting it into the hands of a board is something concerning for me.
Representative Baji.
Thank you, Mr. Chair. Thank you, Representative. I take that as well, to be accessible to our constituents and our members. I think that's very important. I think one of the things, though, that this board does is it does ensure that workers across the industry have a voice, have an opportunity to ensure that they're heard about what their conditions are, rather than kind of that one-on-one interaction. And so I'm hopeful that as we continue to have conversations about this bill and as we continue to refine it, that will become clear.
Any further questions? If not, Representative McDonald.
Thank you, Mr. Chair. Mr. Chair, you're obviously familiar with the Workers' Compensation Advisory Council.
Yes, I am. I served on it for a period.
Pretty important council, wouldn't you say?
It was set up, and it was, my understanding, Representative McDonald, it was set up to take those issues that tended to, depending on which side of the aisle you were on, were hit back and forth between, and they either improved or just or weakened workers' protections. And they set this up so that labor and management could get together and talk about these issues and move them forward and come to an agreement on issues that they both could work with. Representative McDonald.
Thank you, Mr. Chair. Representative can you please help me?
Yes. Mr. Chair, Representative McDonald, it is pronounced Agbaje. Agbaje.
I said it right in my head, but it couldn't come out that way.
No problem.
Thank you, Representative. So the Workers' Compensation Advisory Council is very important for labor and management employees and employers. And it's a board that comes together and works out all the problems and comes up with great solutions and brings it back to the legislature and gives us the authority to vote upon. With your board, it circumvents the legislature completely, 100%. And for that, it gives us lawmakers no authority whatsoever going forward. And it really doesn't get to the crust of the issue, which is funding for our nursing homes. So do you believe that your bill will help some of our rural nursing homes that are on the verge of closing their doors because of lack of funding? Your bill costs a lot of money, hundreds of thousands of dollars in the future. That money, don't you think, would be better spent in funding, fully funding our workers who are taking care of the most vulnerable and the elderly?
Representative Abaji.
Mr. Chair, thank you, Representative McDonald, for that question. I think that's right. We do need to fund our nursing homes. We do need to fund the sectors of our society that need the most help. What we also need to do is we also need to ensure that the people who are working in those places have that voice in that space. And so what this bill does is it creates this board. They work with their regulators, they work with their employers, and the workers also have that opportunity to bring in a true worker perspective. And so that's what we're getting at with this board, to ensure that what we're hearing from workers and what we're hearing from industry and what we're hearing from regulators can all work together to ensure that the highest standards are being met. I think, one of the issues I think when it comes down to it is like we will have to, make a decision about, how funding is spent. I think a number of committees are discussing that now and where that goes. But one of the things that this bill wants to do is ensure that the people who are most affected by the amount of money that's going to be coming to our nursing homes have a say and the accountability of that funding.
Representative McDonald.
Mr. Chair, thank you. I do ask for a roll call on the vote, and then just...
All being asked for, there'll be a roll call.
Thank you. Just a thought, Representative, that hearing from the leading age Minnesota, the long-term care initiatives, imperatives, and the care providers who work in this industry for many years, long before I was here and long before you were here, are shared their concerns. And we as lawmakers come up with a law. We think we know best. I have guilty of that as well. Bring in a DE2 amendment at the last minute on the first stop, giving the public and those who care about this issue, including you, Representative, and who have worked on it for years, no opportunity to read the amendment and then have to testify. I would assume that both sides do it. I think, Mr. Chair, that practice has to end. It's not fair to the representatives, and it's certainly not fair to the constituents and those who are work so hard on the issues. To bring an amendment in with no warning whatsoever, no opportunity to read it. So, Mr. Chair, I think that practice, really, we have to do a better job. And I hope the other side's listening, that we as lawmakers, it's not fair to the public. It's not fair, especially in this bill, with those who have worked their entire lives for the aging and for long-term care and for nursing home, not to have an opportunity to read a bill before it comes to committee, when they already had and were up to snuff on it. Are you aware, Representative, that the Centers for Medicare and Medicaid, which includes nursing facilities, are pretty much, I think this April, are going to release a proposed nursing home staffing mandates for Medicare skilled nursing facilities this April?
Representative Badje and Representative Donald, if we can get wrapped up here, we need to move on. Representative Badje.
Thank you, Chair Nelson. Thank you, Representative McDonald. Just to address quickly, the DE2 amendment was posted according to the rules of the 24-hour rule. So I know it's quick, but we did have it up with a day's notice, which is according to the rules. On the question about the staffing conditions that are meant to come out, again, this bill doesn't cover staffing. It would only talk about working conditions and wages, but it wouldn't discuss anything that is pertinent to the residents of the nursing home, because that is covered through the federal government and the state.
Representative McDonald, wrap up and so we can get off.
Yeah, thank you, Mr. Chair. Well, Representative, that's not entirely true, or not a fact, because certainly this bill would affect both the residents and the workers as well. Just our concerns, it's tough to be in the minority because we always have to be a Debbie Downer and point out areas of concerns of a bill that are brought to our attention, which you heard today in testifying, and hopefully bring that to light, that you can take that consideration. Your friends on the other side of the aisle, we are guilty of it. We're in the majority. We're not going to point out any errors and deficiencies publicly, but I just advise you to take note of the concerns of those in the industry. I'm not an expert by any means, but those who have been working in long-term care and the nursing facilities, who you heard need funding for their home care workers. That's what's important. And I just hope that you take to heart their concerns and perhaps make some amendments to your bill going forward. I think that'll make you a better lawmaker. I think it'll make our workers who take care of these loved ones better workers, and with more certainty and sustainability for our nursing homes. So with that, Mr. Chair, I wrap up my conclusion.
Thank you, sir. Representative Badje, I think I heard you talking that you've been working well with the people and moving forward. I trust that you'll continue to work with the people that have concerns about the bill. And with that, do you want to do a quick wrap up and then we'll get to a vote?
Sure, not to take too much time. Thank you, Mr. Chair. Thank you, members of the committee. I appreciate all the concerns that have been aired today. I will just say, as I do my work, I continue to work with those who may have different ideas about the bill than I do. And sometimes they come up with something that's actually really useful. And so I look forward to future conversations with anyone who has concerns or interest in the bill. And I think that that's the best way that we all can work as legislators. So I hope that you guys will continue to support this bill as it moves through the committees. And should you have any questions or concerns, my door is open.
And with that, I'll renew my motion that House File 908 as amended be re-referred to the Human Services Finance Committee. And clerk will take the roll.
Chair Nelson?
Aye.
Nelson, aye. Vice Chair Berg?
Aye.
Berg, aye. Lead McDonald?
Nay.
McDonald, nay. Representative Daniels.
Nay.
Daniels, nay. Representative Greenman is excused. Representative Hill.
Aye.
Hill, aye. Representative Hussein.
Aye.
Hussein, aye. Representative Jordan.
Jordan, I.
Jordan, aye. Representative Koslowski.
Aye.
Koslowski, aye. Representative Meckland.
Nay.
Meckland, nay. Representative Myers.
Nay.
Myers, nay. Representative Schultz.
Nay.
Schultz, nay. Representative Wolgamott.
Aye.
Wolgamott, aye. Mr. Chair, with the conclusion of roll call, we have 7 ayes and 5 nays.
With 7 ayes and 5 nays, the motion prevails. The bill is on its way to Human Services. Thank you, Representative Ajay.